I'm Dr. Saka Amidat. I'll be presenting asepsis in surgery, and my moderator is Dr. Farouk. Here's the outline. There's the introduction, history of aseptic techniques, definition of some terminologies, methods of disinfection and sterilization, principles of aseptic techniques, aseptic techniques itself, then procedures that require surgical aseptic techniques, then the breach and complications associated with asepsis, conclusion and references. Introduction. Asepsis can be defined as a term used to describe methods which prevents contamination of wounds and other sites by ensuring that only sterile objects and fluids come in contact with them. The aim of asepsis is to prevent infection and to ensure patient safety during and after surgical procedures. History of aseptic technique started in 1847 by Ignaz Selwys, who introduced hand washing after identifying the lack of it as a factor associated with increased bacterial sepsis. Then in 1865, Joseph Lister, also known as the father of antiseptic surgery, developed antiseptic surgery techniques by making use of carbolic acid to clean surgical instruments. Then in 1880, autoclave as a method of sterilization was invented by von Bergman. This slide is just basically showing the definition of some terminologies. So when we have cleaning, it's a process that removes visible contamination but does not necessarily destroy microorganisms. While antisepsis is a procedure or application of an antiseptic solution or an agent that inhibits the growth of microorganisms while remaining in contact with them. Then have disinfection, which is a process that reduces the number of viable microorganisms to an acceptable level, but may not inactivate some viruses or bacterial spores. Then there is sterilization, which is the process of destruction or removal of all microorganisms from surfaces, which includes spores. So the main difference between disinfection and sterilization is that disinfection does not have effects on spores, while sterilization destroys spores. Then we have sanitizing, which is the process that reduces microbial population on objects to a safe level. Then we have decontamination, which is a process that removes pathogenic microorganisms from an object to make it safe to handle. So contamination is like an umbrella term. It encompasses sterilization and disinfection. The difference between antisepsis and decontamination is that antisepsis is a term that is majorly used for living tissues, while decontamination involves a term used for non-living things. This is a slide showing the methods of disinfection and sterilization. It is a process that involves reduction in the number of viable organisms, and this can be achieved through one, physical methods. So the physical methods include application of heat, which can involve low temperature steam, boiling of water at 100 degrees Celsius, then pasteurization and ultraviolet light. Then we have the chemical methods. These include use of chemicals like chlorhexidine, cephidine, and amongst others. By way of classification, disinfectants can be classified based on consistency. So we have one, liquid. Example is alcohol. So for alcohol, the mechanism of action is that it dehydrates the cells of microorganisms by disrupting the cell membrane, and it also affects the coagulation of microorganisms' protein. Examples of alcohol include ethyl alcohol, isopropyl alcohol, methyl alcohol. Then the application of alcohol include use of 70% solution of alcohol. Example is spirit, which is an antiseptic that is used on the skin. Then isopropyl can be used to disinfect thermometers. The disadvantage of using alcohol as a disinfectant include it can be an irritant to the skin and it's very volatile and inflammable. Then another example of disinfectant is no. Then we have gaseous type, which include formaldehyde vapor, ethylene oxide. Then another classification of disinfectant include the spectrum of activity. So you have the high level, you have the intermediate level, and you have the low level. Then you have another classification based on mechanism of action. So one, you have action on membrane. For example, alcohol and detergents. Then disinfectants that cause the naturation of cellular proteins include alcohol and phenol. Then you have oxidation of essential sulfuridyl groups of enzymes, which include hydrogen peroxide, halogens, and others. Then those that affect the nucleic acid of microorganisms include ethylene oxide and formaldehyde. This is a slide that is basically summarizing the spectrum of action of each of the disinfectants as discussed earlier. So here we can see that the high-level classification of disinfectants, it does not have effect on vegetative cells, but has effect on mycobacteria such as TB. Then it also has effect on spores, fungi, and viruses. Examples of high-level disinfectants include ethylene oxide, formaldehyde, and others. Then you have the intermediate classification, which has no effect on vegetative cells, but has effect on mycobacteria, no effect on spores, but has effect on fungi and viruses. Examples include halogens, phenolics. Then the low-level classification has no effect on vegetative cells, but has effect on fungi and has variable effect on viruses. Examples include ammonium compounds, alcohol, sterilization method as another type of decontamination. So the sterilization method can be physical and it can be chemical. So physical, we have it by making use of it, and this includes use of autoclaves, while the dry one involves use of air ovens. Then we have radiation as another physical method of sterilization, and then we have filtration as well. Then you can have chemical method as a method of sterilization. So examples include the use of ethylene oxide, gas, plasma, sporide chemicals, low temperature steam, and formaldehyde. This is a slide explaining what an autoclave is. Well, it's said to be an effective means of sterilization because it has high penetrating capacity and it gives large amount of heat to surface area with which it comes in contact with. So achieve sterility, a holding time of at least 15 minutes at 121 degrees Celsius or 3 minutes at 134 degrees Celsius above atmospheric pressure is required. So there are different types of autoclave. We have the simple or pressure cooker type laboratory autoclave. Then we have the high pressure pre-vacuum autoclave, and then we have the steam jacketed downward displacement laboratory autoclave. What are the indicators of adequate sterilization in autoclaving? Well, we have physical method, which includes use of temperature charts recorder. Then you have the automatic process control, and you have the thermocool. And we have biological method, which include use of paper strip containing terrorist parasitic spores of Geobacillus stereothermophilus. Then you have the chemical method, which include use of brown stew and succinic acid. What are the principles of aseptic techniques? You have 4 key principles, which include 1, maintaining a sterile field, a sterile personnel, then use of sterile equipment, and aseptic procedure should be done in a sterile environment. Aseptic technique itself can be classified as follows. 1, you have the pre-operative antiseptic technique, you have the intraoperative antiseptic technique, and you have the post-operative antiseptic technique. So pre-operative antiseptic techniques are measures that are employed in achieving asepsis from when the patient was admitted up onto the commencement of the surgery. And these include one, treatment of active infections at the site of surgical incision. Then ensure that pre-operative stay is as short as possible. Then adequate bowel preparation is required. Then a patient is required to wear a clean gown. And preoperative use of antibiotics at induction of anesthesia. Then skin preparation. So this slide is basically buttressing on what skin preparation entails. So according to the WHO guideline, appropriate preoperative skin antisepsis is a critical component in reducing the risk of surgical site infection. So skin preparation actually involves one, shaving, and shaving should be done when necessary. It should be done on the operating table, and this should be done few minutes prior to the time incision will be made, because research has shown that wound infection is lowest when shaving is done few minutes prior to the surgery, while infection rates is said to have increased to about 1 to 5% if shaving is performed greater than 12 hours prior to surgery. This is because abrasion can cause colonization, which can lead to wound infection. So you can do shaving by making use of clippers or creams. What are the advantages of shaving? Well, it makes surgery easier, and it makes suturing and dressing removal easier. Another step in skin preparation is cleaning or washing of surgical sites. This involves preparing the operation sites, including the skin area around the op site. It involves scrubbing the area with sponge impregnated with detergent, and then after which the skin is cleaned. Antiseptic solutions such as chlorhexidine, povidone iodine are applied. This is a slide that is basically illustrating how skin is prepared for surgery. So there are three prepping theory. One is clean from a clean site to a dirty site. So you move from a clean area to a dirty site. Another is cleaning from surgical site outwards. So you move from the surgical site outwards. Then do not redo an area. So you do not go back to the area where you had clean area. There are sources of infection. Primarily, a patient is a source of infection, while the secondary source of infection is the operating room as well as the team involved in operation. So there are basic requirements of an operating room, which include one, the environment. The environment should be sterile enough in order to minimize bacterial contamination. And the size of the operating room, the minimum size should be 20 by 20 feet. Then the temperature in the operating room should be between 20 to 22 Celsius. Then the humidity should be around 60%. Then the space should be sufficient enough for team movement, gowning, and patient draping. This is also one of the requirements for an ideal operating room. So this slide is basically explaining how the operating team should conduct one another and the process of patient draping. One, it involves hygiene, good personal hygiene, ensure adequate hand washing, and scrubbing, which involves scrubbing of the hands and arms to the elbow with antiseptic. Then sterile clothing, which involves use of sterile gowns, caps, face masks, surgical gloves, which is also reinforced by gowns. Also, movements should be done face to face or back to back. Then in patient draping, you make use of sterile drapes, which helps to define and preserve the sterile field. Then the materials that should be used for patient draping should be disposable or reusable fabrics that are impenetrable to bacteria. Draping technique can be done by one, holding materials above the waist level. Then you drape from the operative site to the periphery. Then you do not move or lift drapes once placed. So you monitor the drape cables appropriately. There are different types of hand washing. You have the social hand washing, you have the clinical hand washing, and you have the surgical hand washing. Hand washing is a prerequisite for maintaining sepsis in surgery. So surgical hand washing is required before any invasive or surgical procedure requiring the use of sterile gloves. So an antimicrobial skin cleanser containing chlorhexidine or comedone is used. For surgical scrubbing, the purpose is to reduce resident and transient skin flora to a minimum. Proper hand scrubbing and wearing of sterile gloves as well as gown provide patients with best possible surgical outcome. This slide is basically illustrating the proper way to wash hand and scrub. So the first one is showing palm to palm. You wash your hand or you scrub your hand palm to palm, after which you place the right palm over the left dorsum and the left palm over the right dorsum. Then the third step is to place the palm to palm with fingers interlaced. Then you scrub the back of the fingers to while opposing the fingers interlocked. Then you do a rotational scrubbing of each of the fingers, and then you scrub the inside of each of the palms. This slide is basically illustrating proper donning of sterile gowns. One, after scrubbing, you ensure you dry your hands first. Then you pick up the gown. Then you let the gown unfold. Then you fold to locate the sleeve or the armholes. Then you slip into each of the sleeve. Then you hold arms out and slightly pull it up. Then you ask the sector to pull the gown on appropriately for you. This slide is basically illustrating how to wear sterile. So first you pick up one glove with the thumb and forefinger. Then pull the glove on the hand. Then you slip it partially. You slip the partially gloved hand on the cuff of the second glove. Then you pull the second glove over and pull the glove up to the gown wrist. Then you slip each fingers in appropriately. Assessing appropriate and adequate lubrication. So what are the post-operative antiseptic techniques? We have dirty and biologically contaminated materials that are subjected to disposal. Then immobilization, use of prophylactic antibiotics, removal of sutures at appropriate time, and timely removal of drains. Which procedures require surgical asepsis? Intraoperative antiseptic techniques involve gentle handling of tissues, careful hemostasis, and appropriate and adequate irrigation of the surgical site. Then you have the post-operative antiseptic techniques, which involves use of prophylactic antibiotics, removal of sutures when appropriate or at due time, then timely removal of drains. Which procedures require surgical aseptic technique? Major and minor surgeries, any medical procedure that involves penetration of body tissues, invasive procedures such as femoral catheterization, tracheostomy care, changing of wound dressing. Then you have catheterization of the urinary bladder. What are the common breach in asepsis? One, you have examples include inadequate hand washing, touching of sterile equipment with unwashed hands, lack or improper use of personal protective wears, reaching of sterile field by reaching over it or allowing sterile items to get in contact with non-sterile items. Then proper sterilization of equipment itself, not following protocols for catheterization and its maintenance, Then you have administration lapses, which was inadequate training or infection control policies or failure to maintain infection control. Are the complications associated with breach in asepsis? Well, one, you have surgical site infection, which is a feared complication after surgery. You have breakdown of wounds after surgery, peritonitis, which is inflammation of the peritoneum after surgery. Then you have osteomyelitis, bacteremia, which is spread of infection into the blood. Then you have endocarditis, as well as increased hospital stay and cost. Conclusion: asepsis and antisepsis are very crucial in surgery to prevent infections, primarily from the patients, then followed by the surgical team, as well as the operating room conditions. This necessitates rigorous sterilization of instruments, proper skin preparation, and strict adherence to protocols by the surgical team. These are my references.
You are scrubbing a patient. Can you just give us steps? How do you scrub? Like the anterior abdominal wall, now the skin. How do you scrub? Skin preparation now.
If I want to scrub a patient, assuming I want to make a midline incision, making that as an example, I will start from where I intend to make my incision and outside. After I have already scrubbed and gloved, so I would scrub from the incision site away from it using luminol iodine or Quercetin solution 2 times, then dry. I'll use a dry gauze, then I will now paint with either spirit or polymer before making the incision.
If you are using a diatomy and you are using alcohol, some people will say that some people will not even use alcohol, but if you are going to use, you must make sure that there's no pool of alcohol collecting on the skin. You must dry it before you commence the use of your diatomy because it's inflammable, like you said.
When you were talking about your aseptic techniques into your pre-operative, intraoperative, and post-operative, I saw that you put your antibiotic administration as pre-operative. I think that will have prophylactically, I think it would be more appropriate if it's in the intraoperative aspects. And then pre-operatively, something that you forgot to mention, we have pre-operative showers. Patients can take showers. Even the shaving is supposed to be intraoperative. So what can do the day before or rather in the morning of the surgery, patients can take showers as a pre-operative antiseptic technique with antiseptic soap before this procedure. And then outfits as well. It's very important. If you notice patients that come for elective surgeries, we will tell them, make your hair neat and some don't come in with big weaves or big wigs, no cosmetics. If patient is having surgery now on the hands, for instance, maybe patients will have no nail polish, trimmed nails. Those are some of the things that you will tell them. The operating theater too, the design of the theater, the fact that you don't want too many people around the theater, moving from the aseptic region to moving around, and then you want strict rules to be applied during this time. Cautions, so keeping the floors dry.
What is sterilization? Sterilization just talks about subjecting the instruments to steam for 3 consecutive days. It is just to ensure effectiveness. Like after the first exposure, like some of the spores can grow. So we'll subject it to this steam for 3 consecutive days. So to ensure effective eradication of the spores.
Sterilization, I guess she doesn't know, is about, in terms of sterilization, most agents kill microbes, most microbes, or spore is the problem we often have. So sterilization is mostly for liquid. You heat to 100 degrees centigrade. Allow the temperature to stay for about 30 to 1 hour. Remain at 100. Then you now cool it. Then incubate the component again, so that the spores that are not killed can grow. Then you see those spores and you. So it's an intermittent procedure. You do it 1 to 4 times for about 5 cycles, 5 cycles, in order to be able to kill all microbes, all spores maybe that you want to eliminate.
Do you want to do tintalization and not the normal sterilization?
It's because of the spores. The normal sterilization, you can kill microbes with it, but there are some spores that may not die. So you aim at giving intermittent, so that's the idea of sterilization. You don't just do it once. In the process, you heat, incubate to see that anyone that survives that grows again, you go back again and sterilize.
Okay, so is it something you want to be doing for? Is it a practical procedure for clinical usage? You did apparently yesterday morning. So why are we talking about 1970 issues now? Why are we talking about 1970?
In the 19th century, 1970, 19th century, I mean.
Yeah. The issue is this. Look at the practical application. You are a general surgeon, did a laparotomy yesterday. You are to do another one today. Do you have the luxury of culturing the instrument that you have sterilized? You open it, take sample with a swab, wait for 3 days for it to grow, and re-sterilize the instrument again.
No. But it's a method to be mentioned. It's not like it would discard it totally. People do it.
Okay, now what is the normal protocol? What's the normal protocol for sterilization?
Well, the autoclave.
So what is the protocol? How many minutes, at what pressure, what temperature, things like that? That's what I want to know.
Autoclave, the people autoclave for up to the temperature is over 120, and you autoclave for about, depending on the device you have, 30 minutes to 1 hour, depending on the device you have.
Disinfection does not have effect on spores, while sterilization has effect on spores.
So what does disinfection have effect on if it doesn't have effect on spores? So disinfection, usually chemical, have effect on the living bacteria. And the reason it is like that is it's most times used on the human body, on living tissue. You are not going to sterilize the skin of the patient, are you? You cannot sterilize it. You cannot sterilize it. So the chemicals you are applying, the Savlon, the povidone iodine, the spirit, and all those things, some of them will kill spores, but it cannot kill 100%. All right? It's mainly for the living bacteria. But for sterilization, our goal is to eradicate the spores so that there is no inculcation of the spores into the wound of the patient. Regardless of the type of autoclave being used, there's a set pressure. I can't remember the values now. It's something we can check, but there's a set pressure. There's a set temperature, and there's a set time. If I can remember faintly, it's about 45 minutes to 1 hour. And then the pressure goes to about maybe 200 bars or so. And then, of course, it's going to be steam. So when you are talking about sterilization, you mentioned these 3 things. the pressure at which the autoclave should be, the temperature, and then the number of minutes. If these three things are not fulfilled, sterilization will not be achieved. So if we use a boiler, for some of you that may have seen the nurses, if you go to the dressing room, some of them have a boiler, like a container that keeps boiling water. That is not sterilization, because the boiling water doesn't have enough pressure to kill the spores. It's just to reduce the number of contaminants and organisms on the instrument. Or some of you that have seen in private hospitals use a bucket centrifuge. Many of them are faulty. Even though you will see a barometer on the cover of the autoclave, but many of them are faulty. But if you want to know how sterilization is properly done, look for a 300 liter or 150 liter autoclave, or go to the CSSD of the hospital and ask them. You will see how they time, the procedure, the pressure they maintain, and the temperature. And even that timing is not counted from the time the instrument is put in the autoclave. Neither is it counted from the time they start heating. They count the time of the sterilization from the moment the pressure is attained. That is when the timing count starts. Then when the time is over, they release the pressure and now bring out the instrument. Then you can be sure that the spores on the instrument or whatever you're autoclaving, the material has been killed and destroyed.